All right. Hello, welcome.
Hi.
Hello, everyone. Today I have a special guest on. This is my mom, Amy Schefer, and she runs Advocate Angel. You can find her on advocateangel.com.
Right.
I will put her links in the description below. You know, I should just save that for the end. Okay. I will go from the top.
Okay.
All right. Hi guys, my name is Lazer. Welcome back to the channel. And today we have a very special guest. This is my mom,
Amy Schefer.
She runs Advocate Angel, where she helps families who are in medically complicated situations find the best care for their loved ones or for themselves. So, do you have anything you want to add on to that one?
Well, I'm happy to be welcoming Lazer to my show today.
Yeah, we're doing a dual episode here. So,
yeah.
Hi. On the channel.
We're going to be talking about a really heartwarming, effective moment in Lazer's medical history in the form of a recent appointment. Since I'm helping families often learn how to advocate well, one of the first and foremost things is to have really quality relationships with every sort of practitioner and constantly be looking to improve those and bring out the richness, the best richness that you can out of the interactions, because the quality of care will go up and the results will be higher when you do that.
Yeah, and today's topic for my channel is pretty much the same thing, specifically on how to get the best care from your providers and maintain a relationship, like she was saying. So this actually comes from a recent example from a doctor's appointment I had with my otolaryngologist, who was helping me look at my hearing aid site, which has been very unmanaged the last few months, to say the least. And so she helped me to get it back on track, which is fantastic. But during this appointment, there was a big change that happened in our relationship, and specifically it started by how I changed how I interacted with my provider. And the big change was, believe it or not, I shared fully what is going on with me, especially around pain. I realized after a talk I had with my mom that I was not sharing anything with my doctor about when she was like cleaning my ears when I was a kid. That always hurt, and I never opened my mouth. They just wanted to get it over with.
You got a frown on your face, and you're sort of grit your teeth, and
like, no, it's fine. It's fine.
Always wondered what was going on with you.
And then a couple other examples where I had to get a numbing shot in my hearing aid area when we were trying to elongate the post, and that hurt really badly. And again, I didn't say anything. I gritted my teeth and pretended everything was fine, which my pretending is not that good because it really hurt badly, and I walked out of there with a real bad attitude. But nonetheless, with this specific provider, I have always had the image of her that I just don't like her, and what I found out was the true reason for that is because I was not sharing with her when she was doing different things to help me out. They were hurting me, and I wasn't saying anything. And over the years, because this is a relationship that has gone on, I think since I was like 8, so that makes it 12 years now, that I've just built up a, whatever you call that. What do you call it?
Resentment.
Yeah.
Yeah.
A lot of resentment towards this provider and judgment against her.
Well, like specifically,
good Lord.
Yeah, you had the idea that she didn't care about you, and she said that she wanted to help you, but that she didn't really care that much.
It wasn't that. It's that I immediately assumed that she wasn't being honest with me when she said in the past that things should should only be a small pinch or like not hurt, and and then they really did, and then I'd be like, "What the fuck? You said this wouldn't hurt, so fuck you then." um, and so I didn't really realize that that's where all of this was coming from until actually I had a conversation with my mom about it, sharing that, yeah, I have this appointment that I really need because it's an urgent thing, but I really don't want to go alone because I really don't like this doctor. And I don't really want to go alone because I don't want to be really rude to her or anything, but I don't know. Anyways, I could state that a lot better.
Well, you could start again. We can edit.
Yeah. I pretty much said all that though already. I don't need to say it again. So,
what I would say, I would add a little insight from the parent end, because one of the things that happens as your child ages is I go from mama bear doing everything and seeing how I want everything to be done to, and the practitioners also go from looking at me to answer things, to looking at the both of us to answer things, to looking at Lazer to answer things. And in teaching, there's a practice called I do, we do, you do. And I've been practicing this for a number of years because Lazer's now 20. It's not up to me. Many things are not up to me. And so in the younger years, I really have shared a lot, like, you really want to include this doctor more. You want to say if it hurts. She doesn't know if it hurts. And you're getting mad. Let's see if we can come up with a way to handle that. But there's not, beyond a certain point, there's not a lot that I can do. And I don't want to intrude on you or be pestering you at a time that's tough.
mm-hmm.
And I totally understand, like, you have reasons beyond, like, I'm not sitting there getting looked at by all of the students coming through and poked at, and I'm not having that experience. So in a certain way, it's like it's easy for me to say how you should feel, right? Or that you shouldn't get mad or something. It's not my role. But my point here for other parents is it's really important to transition over to your grown child driving this huge semi that they're going to be driving for the rest of their life, and having the skills that you want to convey to them and allowing them to drive even if it's not what you would want to see. And so it was so beautiful for me, like, for it to dawn on you, like we were talking ahead of time, right? And you're like, I want to have you come because you know, I don't have the best relationship, and I think I'm gonna have to bring it up, and I'm just gonna say, well, I'm just gonna ask you to be honest. And
Mm-hmm.
we both kind of went, oh, and I said, you know, I think it's
that
really
sounds a lot like projection.
I think it's really about you being honest and saying, guess what, I need to tell you. I've been withholding information from you.
Mm-hmm.
You know, really how it's been this time and that time and the other time is this way.
Mm-hmm.
And so I want to ask that before we start, I want you to know this, and I want to really ask you, is it going to hurt? What can we do about that?
Right.
Yeah. And how did that go?
So, I mean, after that, I went to the appointment. My mom came with me. And I accidentally left my hearing aid in the car. So, as things happened in the appointment, she had to go run and get my hearing aid. And I was talking with my provider, and she was starting to tell me, to get ready to lay down to start looking at helping this issue I had going on here. Um, and I was really hesitant, and I noticed that, and was like, okay, so before I go lay down on this table, I have to be honest. And that's when I brought it up, and I said pretty much exactly what she said to my provider, and it really changed the relationship between us, which has been like very cold slash get it done slash not talking, and on my end very pissy, um, or enraged, I should say, uh, because I wasn't sharing. But this was a complete 180. As soon as I finished sharing, she softened because I had finally let her in,
Yeah.
right?
Which is what she wanted all along.
Which I couldn't see because I was
right.
too busy being mad. And she was like, "Oh, I'm so sorry. I would never mean to cause you harm." I mean, like, of course not, right?
Right. Yeah.
Like, I even know that myself, but at the end of the day, sometimes getting a thought out there, even if you know it's a screwed up one, will resolve it. So, after that, I felt a lot more at ease too, and I laid down, and it was immediately a lot more free flowing. The conversation was, she asked me if things were hurting, and I was honest. And my mom was saying that when she walked back in from getting my hearing aid from the car, that it was a totally different energy than from when she left.
It was so different in that room. It was like, oh, I knew exactly what happened. And then the doctor turned to me and said, Lazer said, blah, blah, blah. And I was like, yeah, I knew that because the doctor was so relieved.
Yeah.
Lazer was so relieved. And, when we were driving away, I said to Lazer, you just made her day because she is working hard all the time. She's a very professional woman at the top of her game,
Mm-hmm.
at a top-notch institution. And she will do the professional thing to make sure everything is done properly. But to receive that degree of warmth from Lazer and to be able to exchange it, totally changed her day, I'm sure. From my point of view, you allowed her to be the brilliant practitioner she is.
Mm-hmm.
And the other thing that we didn't even say yet is, I think if that had happened previously, you wouldn't have waited so long to go in, because this granulation tissue has been really gnarly for a while. And I'm saying I'm saying that as a parent of a 20-year-old. You know why? Because it's not up to me. And if I over hover, that does not give Lazer the best opportunity. Of course, if something is getting to like a danger level, I will occasionally step in and go, I will not have this. And that's
not happening much anymore. So.
Right, it's not happening much because this person totally is distinguishing, like seeing the road ahead and changing course, which is like the proudest mom moment that I could have. Because you changed that relationship, and the quality of the care that you get from that person is like...
Yeah.
Yeah.
And it makes me think if only I had, thought of it sooner, sort of. I can imagine how different a lot of my interactions with that practitioner would have been.
Yeah.
Because I would have handled the issue so much earlier. And I do think you bring up a good point, even though I don't really want to admit it, that I that probably was a big reason for me waiting so long to book an appointment to
Yeah.
get my hearing aid thing looked at. Um, I mean, I'll say a lot of it was denial too. I thought it was just going to take care of itself, and so I wasn't taking care of it properly to begin with. But the other part of it was that I really didn't want to go in and see her. And
Right.
there you go.
And the net result is
I waited so long that
Lazer has
now
not been wearing a hearing aid for quite some time, which impacts other things in life, right?
Yeah, I can't wear my hearing aid now for like 3 months at least while this granulation tissue dies down, because where it grew out is right where I connect my hearing aid. So, anyways, that I mean, this whole experience was something that both of us thought it would be fantastic to share and just put out in video format for others to watch, because I know, at least for me, I've been saying in the past how important it is to share with your practitioners open and honestly. That way you guys can figure out the best solutions together and work as a team. Right. And this was a first-hand experience of that, and just like how tenfold better my interactions and overall care was with her, with my practitioner, was after I was honest. And I know you were saying that you've been handing over the reins.
Right.
And for you, it's been about not doing too much, but not
it's a
discipline. Backing off either.
Right, it's a discipline.
And trying to gauge how involved you need to be in order for me to start being able to navigate things myself.
Right.
And also not jumping down my throat, or
not
being involved at all, and then I end up in the hospital or something. I don't know if that hasn't happened.
Well, no, I'll give a very specific example. Yeah. So I'm going on the basis of I do, we do, you do.
You do. Mm-hmm.
So if you hand off and it's the you do, and the you is not quite picking up what needs to happen.
No, it fell on the floor.
Right. Then there are pragmatic, real things that happen, right?
Uh-huh.
So one of those things was, it is complicated to choreograph the appointments, and it is important to keep all of the appointments that are on the book in your head, and every time that you are in the office, you want to further all of the agendas and push the system. If you wait for the system, it will do it at its convenience, which means things could book out way too long.
Way far.
Way far.
Yeah.
And that's been another thing we've been working on, that I have had to hold myself back. And there are some consequences. It's a complicated thing. Like, does Lazer feel like scheduling? Yay, let's schedule another surgery. No, Lazer doesn't feel like doing that.
Yeah.
Is that gonna, this is me as mom. Do I want Lazer to have any difficulty ever in life? No. Would I like to take care of everything that I could so that Lazer doesn't have any difficulty of the kind that Lazer has had? Yes, I would like that. Is that the right thing for me to do? No. And so I get a little emotional talking about it, because Lazer was kind of crashing at burning at scheduling all the appointments in a timely way.
Mm-hmm.
And a couple of times I've had to say, I am calling and I'm going to handle this now. And we had a funny moment actually with this practitioner, right?
Mm-hmm.
I said, Lazer said, I've been waiting a long time for the scheduling department to call me for the surgery.
In fact,
and Lazer said that
called them 5 to 6 times.
Right.
and have always gotten them on voicemail.
Right.
And the system will say, "Hey, we'll call you back within 2 business days. Please leave us your information."
Right.
Yada yada yada. I'd be like, "Okay, here's your information," and hang up the phone, and I would never get a call back. And I did that 5 or 6 different times.
Right.
And eventually, my mom has been starting to chirp in my ear, "Hey, you need to get this scheduled." I'm
right.
like, "I know, I've been trying to."
Right.
Well, you have to push the system.
Right. Right.
Well, no, I don't want to do that.
And right, like you don't. If it's 48 hours, it's like 2 weeks later. You haven't called them back.
Yeah,
I know. But this is kind of funny. It's not a criticism at all. But in this appointment, the way that it came out is, I said to this doctor, Lazer said, "I've tried 5 times."
And the doctor was telling me too, "Hey, are you going to be scheduled? Because I know you're turning 21 soon.
Right.
And you're going to be kind of out of the Children's Hospital eligibility criteria."
Right.
I'm like, "I know, I've been trying to schedule them."
And I said, "And you haven't sicked your bulldog crass mom on them yet." And she looked at me because, it does take being really, assertive, shall I say. I mean, sometimes the system just can't budge and you need it to. So then it's sort of like you got to make it happen.
You're making way, yeah.
I said, perhaps this doctor will put up her dukes for you, because that doctor has a lot of clout, and it's time to put up the dukes. But I didn't take the control from you. I let you watch me do that in a nice way. I wasn't like saying to her, "Stupid Children's Hospital." I was just like, we need some clout. It's not getting done.
Mm-hmm.
And I also was implying that if you weren't resolving it quite quickly, bulldog crass mama was gonna be off her chain anyway, because that is my job. Like, I'm the guarantor.
Right.
For the rest of your life, I'm always going to be that person. But I'm always considering, I mean, it's better for you to learn the skill, and for you and I to have an awesome relationship, and for me to respect your boundaries and not just like be doing it for you and all that stuff. Because you do have a situation that I don't have. You have had difficulties I've never had to face, and you're going to have to manage that after I'm not here. So the best I can do for you is, teach you really well and honor you, because you're awesome.
And that is more of like the transitional things of what it's like to be a parent.
Right.
Transitioning stuff to the child. And so she was the one who actually brought up the idea of recording a quick video together about this last appointment and some of the key things that like completely changed around with this practitioner's care, or my relationship with this practitioner as well. And some of the dynamics that were involved in setting all of these forces up to happen. So, yeah, thanks so much for coming on.
Yeah, thanks. This is so great to do that together.
I'm laughing because you're probably gonna upload the same video, and I'm acting like we're only on my channel. But,
well, we know that we're only on my channel.
So, it was good to have a talk with you.
I think we should do these more.
Yeah, I'm sure there's a lot of things we could think of.
Yeah. Okay.
But yeah, thank you guys so much for watching.
Yeah, if you have suggestions, if you have things you want to hear us talk about, please put them in the comments below. We'll see what we can cook up.
All right. Thank you guys. Have a great day.
Thank you. was fun, Laser.